Earl Stephenson Jr. here, your Atlanta board certified plastic surgeon. And this is another installment of Sketches to Surgery. I am remote today, so I don't have my dry erase board desk, but we're going to try to make it through. So I wanted to continue to talk about gynecomastia. In the last video, I talked about the generalities of gynecomastia, and we talked about the 4 types. We talked about type 1, type 2, type 3, and type 4. What we want to do today is kind of speak briefly about type 2, what it is, what's the cause of it, and how to treat it. So type 2 is a really subtle form of gynecomastia. If you were to look at a man or a guy's chest straight on, you really wouldn't notice anything. It would be represented by this kind of drawing here where you think things were normal. But to the client or to the guy, he notices a little puffiness around his nipple. Here's an example from a side view, and that's really where you can start to appreciate this. This is type 1, where the nipple and the areola are flat against the chest, and this is not an issue. Type 2, if I move this up a bit, is where you can start to see a little bit of puffiness of the nipple and the areola, and it's affectionately known as puffy nipple, not to be confused with Puff Daddy or P. Diddy. So from a side view, this can be really disturbing to the client, and it can be in a mild form, a modest form, or even a severe form, but rarely is there any excess skin. It's usually just proudness or puffiness of the nipple. So how do you treat that? So if you were to treat that, you have 2 options. Obviously, you can liposuction if you think that's a component of the problem. Rarely is it a component, so it's not as beneficial to this type of gynecomastia. You can remove the gland, and the gland seems to be the main problem. So let me try to zoom in here. There we go. This is a side view where you see the chest muscle, and down here are the abs. This is the proud nipple and areola, and I drew these little circles to represent full or large glands that kind of give proudness or puffiness to the nipple. And so liposuction will not take care of that. If you have some fat around there that you believe you can sculpt and make sure that this skin on either side or around this enlarged gland can come closer to the chest, and that would add some aesthetic value, certainly you can do that. But the way to treat this is removal of these glands. Let's back out. So if you were to focus just on the nipple itself, and we'll zoom back in, this is a face-on nipple, and what you would do, you can do this under local anesthesia with Novocaine only, and it can be done in the office. You can do it under local anesthesia with a little oral sedation, or you have capability for IV sedation, or if you want to put somebody to sleep completely with full general anesthetic in the appropriate surgical center or outpatient facility, a hospital, you certainly can do that as well. What you typically do is you numb this area up and you make a little incision inside the brown part of the areola. You get underneath that skin and you tease out these glands from the breast tissue till you reduce those enough till you have a flat nipple against the chest. And that really is a nuance and an art. And once you've done that, that's all you really have to do. You put this together with a couple of stitches of choice, dissolvable, non-dissolvable, and then you go about healing in the usual manner. So type 2 gynecomastia is a mild form and can be treated very readily, and it doesn't require typically a major operation. So again, I wanted to briefly touch on gynecomastia. In our next video, we're going to jump to type 3, which can be a little bit more involved. If you like these videos, please comment below. If you like my channel, please subscribe, and please spread the word. And again, this is Earl Stephenson Jr., Atlanta board certified plastic surgeon. See you next time.